Hi, this is Liberato Martinez, and thank you for joining me today. Today, we are going to break things down and make it a very quick and easy video. We're going to make this as easy as ABC, easy for you to understand. You might notice I'm wearing a suit today. I'm much more casual with my t-shirt and jeans, which is my preference, but you got lucky today. You got me in a suit. So let's go ahead and get started. So happy birthday, you're turning 65, or let's say you're leaving your work plan and you're new to Medicare. Well, you may have a lot of questions. Everything's kind of like alphabet soup to you, so let's break it down for you. The first thing you need to do, and I have another video that talks about enrollment periods, and we'll get to that, but what you need to do prior to turning 65, 3 months before you turn 65, and my recommendation when you leave your work plan, start the application process about 2 months before you leave your work plan. You need to apply for Original Medicare. That's Medicare, Original Medicare, Medicare Part A. You need to apply for both Medicare Part A and Medicare Part B. B like boy. Now, Medicare Part A is $0. You've had to work in the country for at least 10 years, worked your 40 quarters, paid your taxes. So Medicare Part A covers your hospital, and that typically comes with a $1,634 deductible. Don't worry, because you're going to have a couple of options to eliminate that deductible. Now you also have to apply for Medicare Part B, B like boy. In 2024, that monthly premium for most people is $174.70. That covers your medical. Now, that may go up next year, may go down. I've seen it go down, but this year it's $174.70. Now, one of the things to be careful is that it covers you at 80% co-insurance for non-preventative services. So there's no limit. You get a $100,000 bill, you're responsible for 20%. There's no limit at all. So don't worry though, because we're going to have some options for you to eliminate that. There's also a $240 deductible for Medicare Part B as well. That's one time. And then that's Original Medicare. So that's Original Medicare, also known as Traditional Medicare. You have the option to stay in Original Medicare and also purchase a prescription drug plan. Average cost in the United States, around $35. Okay? Now, you do run the risk of running with that 80%. So be warned. Now, you have two options. First option, Medicare Supplement, also known as Medigap. The reason they refer to it as Medigap is because it will fill the gap of Original Medicare. Original Medicare will pay first. Whatever Original Medicare does not cover, Medicare Supplement will fill the gap, minus a deductible if applicable. So, most common is Medicare Plan G. Varies in rate around the country, depending on your geography, depending on your age sometimes. But the average rate is around $130 a month, average rate, more or less. That's in addition to your Medicare Part B premium. You also have to have a prescription drug plan. You have to have the prescription drug plan. In addition to that, average rate around the country, depending on your medications, $30 a month, just as an example. So that gives you $160 there, plus your $174.70. So you're going to have to add up your Medicare Plan G, your Medicare Plan D, that's $160 plus the $174.70. My cheat sheet, that gives you $334.74 per month at age 65, average cost around the country. Now, how it works is you're going to present your traditional Medicare card. Whatever it doesn't cover, it's going to pay the bill, but what it doesn't cover, Medicare Supplement will fill the gap. Plan G does have a $240 deductible. That's for 2024. Your other option is to go with Medicare Advantage. So there's different reasons. Both have its pros and its cons. If money's not an object, you're going to get very, very comprehensive coverage here with Medicare Supplement. Before I move on, I don't want to forget to tell you that Medicare Supplement does not have a network. That's super, super important. Medicare Supplement does not have a network. So you can go see any doctor in the United States as long as they accept original Medicare. You have a lot of freedom with Medicare Supplement. So that's Medicare Supplement. Medicare Advantage. Medicare Advantage, also known as Plan C, Part C, also known as Part C. Medicare Advantage typically varies around the country, but most common, Medicare Advantage costs you $0. That's right, $0. You still have to pay your Part B premium, but it'll cost you $0 in most cases around the country. It does include your prescription plan, so you don't need to pay an additional amount for your prescription plan. That's for the plan itself. It does not talk about different copays for your different types of medication. So total cost for your Medicare Part C and your Medicare Part D, D like drug, D for medication, is $0. You only have to pay your Medicare Part B, $174.70. Now, Medicare Advantage will take over. It will replace original Medicare. The private insurance companies will now be managing your care with your doctor and improving bills. So it usually comes with a $0 deductible. That's nice. You do have some protection with a maximum out of pocket. Maximum out of pocket amount protects you. So for example, let's just pick a number. Let's say it's $1,000 maximum out of pocket. You're not going to pay more than that in one calendar year. They range for in the low hundreds all the way up to $8,000. So it depends on your geography, but you will have a maximum out-of-pocket protection. And it's also going to come with a lot of extras. Again, it varies by geography, but it'll include your dental, your vision, your hearing, also things like a gym membership, over-the-counter allowance. They vary across the country, but there's a lot of additional benefits that you're going to get with Medicare Advantage. There is a network. If it's an HMO, you're going to need a referral to go see your specialist. If it's a PPO, the doctor has to accept the plan. The doctor has to be in network with the PPO in order to accept the plan. And you have some copays, but remember that protection with maximum out of pocket. Both are very good options. It depends on your situation. So it depends on you. So if you would like to have a free consultation, please feel free to call me, or you can talk to myself, you can talk to one of our agents. We're here to help you. That's what we do. And we do this at no cost to you. So please feel free to give us a call. My name's Liberato Martinez. Please take the time, like and subscribe. I'm going to be sending out a lot of videos out to you to educate you so that you can make the right decision for yourself. Have a great day. Thank you so much.